Hello, everybody. This is Pilar Mazzetti from the Ministry of Health of Peru. We would like to share with you the progress we've made with improving childhood cancer services in our country. First of all, we would like to discuss with you the situational diagnosis of childhood cancer. Our country has one of the highest mortality rate for childhood cancer in all Latin America. As you see, this is the mortality rate for Honduras, for example, and here we are the second one. Peru is in the second place regarding the mortality rate for childhood cancer in Latin America. As you see here, in between non-communicable diseases for the pediatric age in our country, cancer is the main contributor to disability-adjusted life years among the pediatric age. The overall survival rate for our children with cancer is, as you see, almost 58%. Mostly regarding leukemia, central nervous system cancers, and retinoblastoma. This is the number of children and also adolescents that have cancer and have attended the Ministry of Health hospitals between 2019 and 2020. The new cases are in orange. All the attending cases are in yellow. As you see, the numbers are all around 200 patients and almost around 50 new cases each year. But from March 2020 on, our numbers have diminished in a very important way because of the coronavirus pandemic. Which are the main identified problems in our country? First of all, the late presentation of children with cancer. After that, the fact that we have centralized cancer centers, as I will show in one of the next images. Then, the problem we have is abandonment of treatment. It is very difficult for the families to continue treatment for their children. And most important of all, the lack of a national childhood cancer registry that can guide us. Numbers are very important to take decisions. The mean diagnosis latency of our childhood with cancer is around 107 days in our country. Regarding developed countries, it's more than threefold the number. This is the cause why we have mostly patients that arrive to the hospitals in the third, fourth, or fifth stage, and the survival rate, of course, is very low. This is what I mean regarding centralized cancer hospitals. This is Peru, the coast of Peru, the Amazon jungle over here, and the Andes in the middle, in between the coast and the jungle. Here you have Lima, the capital city. We are 32 million of Peruvians. 11 million of Peruvians are living in Lima. It's to say the capital city has 1/3 of our hospitals. In the northern part of our country, we have 2 other hospitals. In Arequipa, in the southern part, 2 hospitals. And here in Cusco, just 1 hospital at Cusco. 90% of the children with cancer are attended in Lima. So people from the Andes come to Lima. People from the coast come to Lima. People from the Amazon jungle come to Lima or to the northern part of our country. And the Ministry of Health, as the most important part of our health system, takes in charge 70% of our population. In our country, 70% of our population is taken in charge by the Ministry of Health, and around 30% of the population has regular insurance, a stable work, and they are taken in charge by a system we call salud. That is why we have in our country almost 70% of the population that is taken in charge by the Ministry of Health regarding cancer or any other disease. Up to 80% of our children with cancer will abandon treatment, mainly due to the social level and the economical level of our population. Socioeconomic level and the low level of parental education are the most important factors. After that, most of our population think that cancer is not curable. Of course, as you have seen, our children come to us in a very late stage, and we need most of the time radical surgery. But low level of parental education and low socioeconomic level are the most important causes. Remember that 18% of our children will abandon treatment. These are very important factors, and the results are related to survival of our children. Regarding our action plan, in June 2019, Peru was chosen by the World Health Organization as a focus country for this global initiative against childhood cancer. This took us to conform 13 working groups regarding pediatric oncology specialties. On July, the same year, our personnel in the first, second, and third level were trained, most of them during virtual training and in many cities also face-to-face. On March 2020, we had our health directive for the early detection and care of cancer for our children and adolescents. Even though we were in between the beginning of the pandemic, we started a national childhood cancer registry. Up till that moment, there was only one registry at Lima, Peru, for the children that were taken in charge by the National Institute for Cancer. From that moment on, that turned to be a national childhood cancer registry. On September, the beginning of September of 2020, we had the first medical emergency law that was directed to the timely detection and care of our children and adolescents with cancer. And at the end of the same month, a health directive for the organization of all our pediatric and oncohematological services was put into function. Part of the action plan depends on the fact that on June 2019, our country was, as I've already said, chosen as a focus for this global initiative for childhood cancer, which is the main general objective: to reduce, of course, morbidity and mortality for cancer in children under 18 years of age. And inside this general objective, you can see that we want to improve the early detection of cancer. We also want to implement a cancer information system. Information is very important to take decisions in our country. And of course, also to improve the quality of pediatric cancer care. In March 2020, a national policy for the early diagnosis of cancer in our country was also approved, and it defines the pathway in which our children are referred when they are suspected of cancer. Also, late September 2020, a national policy for pediatric oncology services organization in our country was approved. We are going to establish a national network in pediatric oncology. Also, we will define the role of the 3 levels of healthcare in our country for children cancer. And also, there are going to be established health indicators regarding cancer that will be prepared every year in every hospital regarding cancer. That way, we will have the information we need to take decisions in our country. This is what we have regarding hospitals in all over the country. We want to strengthen these treatment units, and also we want to create new units, not centralized but decentralized, for our children and adolescents, not only in Lima but also in many of the regions of all our country. In blue, you will see regions and hospitals. The region is underlined, the hospitals are after the line. These are the pediatric oncology centers, type 1, when you can reach ambulatory chemotherapy, palliative care, the treatment of infectious complications, and the surveillance of our children. Here we have 8 different regions or departments in our country. Also, we have pediatric oncohematology centers type 2, where we can find intensive chemotherapy for our children, radiotherapy, bone marrow transplantation, which is very difficult to achieve in our country, and oncological surgery in orange. There are 4 regions, including the capital city, which is represented here and also in type 1 center all over the country. And with the help of Salud, the system that takes in charge 30% of our population, we want to build this kind of decentralized unit all over the country. Our childhood cancer law will help us to give coverage for all pediatric oncology treatment. Also, something very important in our country. When we have one of our children with cancer, we will have to stop working and take in charge our child. A work license has been established for the parents for children with cancer up to 1 year to help the family to deal with the problem. Also, our cancer programs will be one national program for childhood cancer. This will help us to organize our country, and this will help us to help the families of children that are living with cancer. So I've already said that there were 13 general working groups for cancer. Around 150 healthcare workers are right now being part of these working groups. As you see, each working group wants to work for the early detection, to avoid abandonment of treatment, to prepare surgery for children. Nurses are specially trained in those groups. Psychosocial items are also taken into account. And, of course, it is very important for our children with cancer, the control of infections. Palliative care is part of the things they have to deal with. The establishment of our national registry and to introduce the information we need is also a very important component, and education and organization of our services also. As you see, retinoblastoma, low-grade gliomas, leukemia are 3 of the most important cancers in our country that are specially taken into account by these 13 different groups. At the tertiary level, training has been a very important part because we're training specialists and also nurses. The National Training Program in Pediatric Oncology for pediatricians that are all over the regions of our country, has already trained 4 pediatricians from 4 different regions: Cusco, Arequipa, Lambayeque, and La Libertad. Arequipa, Lambayeque, and La Libertad are in the coast, and Cusco is in between the mountains. They are certified by the National Institute of Neoplastic Diseases and St. Jude Hospital. Regarding training to nurses, pediatric oncology has already been a training for 100 nurses. Half of them last year and half of them this year, even though we have a pandemic. They have been trained in Lima and also in all the 4 countries that are part of our priority. They are also certified by St. Jude and also by AFON. Regarding the primary and secondary level, we have online training from 2018 to 2020. There were 3 massive virtual courses. You see the important number of personnel, health personnel that was trained. Nurses, physicians, and many health workers from Lima and the regions of our country were trained for the early diagnosis of childhood cancer. There was also an on-site training. The on-site training was held since 2018 up to, let's say, March 2020, before the COVID-19 pandemic. Around 600 participants were trained in early diagnosis of childhood cancer and also in palliative care for children that have pediatric cancer. The National Pediatric Cancer Registry was one of our most important dreams. Thanks to the agreement signed between St. Jude Hospital and the Ministry of Health, this cancer registry started on April 2020 as part of a complement for the registry we already had only in the National Institute of Cancer at Lima, Peru. But nowadays it's a national registry. Many educational materials have been given with the help of PAHO and also our civil society, not only to professionals, but particularly to parents. Psychosocial information, nursing information, palliative care information has been a very important contribution, particularly to the parents. One of the most important things regarding cancer in our children is the prevention and control of infections for these children. The DOT project regarding febrile neutropenia was based on one of our biggest hospitals in Lima. It was made in collaboration with St. Jude Hospital, and they wanted to decrease the time to administration of antibiotics in febrile neutropenia. This was of great help, and many hospitals wanted to reproduce this febrile neutropenia project. The Evad project, the Pediatric Early Warning Sign project, was developed in 4 different hospitals: the National Institute of Cancer in Lima, the Regional Institute of Cancer in the southern part of our country, and 2 of the main hospitals in our country that belong to the Salud system, with the idea of having an early recognition of symptoms that may be part of the deterioration in patients that are septic and also suffering from cancer. And they aim to decrease the mortality due to infections in around 24%. As you see, we've made, even though we are in between a pandemic, a great effort to help our children, particularly to recuperate their smile. There's a lot of work to do, and many, many children have longer lives, better lives, successful lives, long lives, if we help all together with this project. As you see, they are once again smiling, and this is Dr. Payet, the director of the National Institute of Oncology in our country, of cancer in our country, and he is also a smile, as we are all of us inside the Ministry of Health, because the smile of our children is also our smile. We want to thank you very much. For our country, being part of the global initiative against childhood cancer has been an opportunity to begin changing. We want to make better the lives of our children with cancer. We want them to have the greatest opportunity. And being part of this initiative, as you see, is beginning to make changes in our country. We are involved in working very, very hard, not only in Lima, the capital city, but mostly all over the country, to give our children the best of the opportunities. Thank you very much.